Hey there, I'm Dr. Leona, and welcome back to another amazing episode of the Hill Deal Podcast. Thanks for tuning in. Today's topic is close to my heart because I'm sharing something I see in my practice every single day. If you've ever felt dismissed by your doctor, told your symptoms are just about aging, or it's all in your head, or if you've been bounced between specialists with no one connecting the dots, this episode is for you. It's especially for women over 40 who are dealing with chronic illness, menopause, or metabolic dysfunction and feeling completely unheard. Here's what I want you to know up front. It's not all completely your fault. You're not broken. The system is. And today we're going to explore why our healthcare system leaves so many of us feeling frustrated and unheard, especially when dealing with chronic conditions. We'll talk about how the system was designed for acute emergencies, but struggles with the complex, interconnected health challenges we face today. And most importantly, I'm going to give you the tools to navigate this broken system and advocate for the care you deserve. All right, so go ahead and grab your favorite beverage, get your pen, paper, iPad, whatever you use to take some good notes for this one. Get comfortable and let's seal the deal to heal. Let's begin. Welcome to the Hill Deal Podcast. I'm your host, Dr. Leona Allen, and I'm here to help you achieve more freedom in your health and your life. I'm the founder of Freedom Health Systems, and I've been a licensed chiropractor and wellness coach for over 2 decades. I've helped men, women, and children transform their lives by removing the physical, chemical, and emotional barriers to natural healing. Every week, I'll be taking you on a journey where you will discover the real truth behind what it takes to heal your mind, body, and soul. Allow me to be your guide as you travel this road to renewed health and a new life. It's time to make a deal with yourself to heal yourself. Please keep in mind that this podcast is for educational purposes only and not to be used as a replacement for medical diagnosis or treatment. With that said, let's begin. Okay, we're going to go ahead and start with the elephant in the room. Our healthcare system was built for emergencies, heart attacks, broken bones, acute infections. And honestly, it's pretty amazing at that. But here's the problem. Most of us aren't dealing with emergencies. We're dealing with chronic conditions that have developed slowly over time. Think about it this way. When you go to the ER with a heart attack, they have protocols, teams, and immediate solutions. But when you go to your doctor with fatigue, weight gain, brain fog, or irregular periods that have been building for months or years, you often get bounced around like a pinball. Here's a statistic that really blew my mind. Chronic conditions account for 86% of healthcare spending in the U.S., yet our system's acute care focus actually results in higher costs and more preventable complications. That means we're spending the most money on the thing we're least equipped to handle well. And that's exactly what I see in my practice every day. Patients come to me after seeing 5, 6, 7 different specialists. The cardiologist looked at their heart. The endocrinologist looked at their thyroid. The gynecologist looked at their hormones. But nobody, and I mean nobody, was looking at them as a whole person. Your body does not exist in separate compartments. Everything is connected. Your gut health affects your mood. Your stress levels affects your hormones. Your sleep affects your metabolism. But the system treats you like a collection of separate parts instead of the beautifully integrated system you actually are. This fragmentation isn't just frustrating. It's dangerous. When no one is quarterbacking your care, things get missed. Important connections aren't made, and you, the patient, become responsible for being the medical detective trying to piece together information from multiple providers who aren't even talking to each other. Are you doing everything right, but still battling fatigue, brain fog, and weight that just won't budge? Here's the truth. It's not your willpower, it's your metabolism, and I can show you exactly how to fix it. I just released a free breakthrough training that reveals why 88% of Americans are metabolically broken and the three-phase system that reverses it. If you're ready to stop spinning your wheels and start seeing real results, go to beginhealingtoday.com. Again, that's beginhealingtoday.com, and you'll also find this link in the description. Now back to the episode. Now let's talk about something that might make you a little bit upset, but I need you to hear this. The economic incentives in your healthcare system are not aligned with getting you well. Let me repeat that. The economic incentives in your healthcare system are not aligned with getting you well. They're aligned with treating your symptoms. Here's how it plays out in real life. You go to your doctor with symptoms of insulin resistance. Maybe you're gaining weight around your middle. You're craving sugar. You're exhausted after meals. A root cause approach would involve comprehensive metabolic testing, nutritional counseling, stress management, and maybe some targeted supplements. But your insurance probably won't cover most of that. What will it cover? Metformin or some other prescription that treats the symptom but doesn't address why you developed insulin resistance in the first place. Get this. 45% of chronic disease patients report negative healthcare experiences, including diagnostic delays and treatment errors resulting from the systemic constraints and fragmented responsibility. That's almost half. And here's where it gets really frustrating. Financial barriers and insurance restrictions means millions of patients delay or forego necessary preventative or root cause care, especially for metabolic symptoms that aren't seen as urgent emergencies. Drug development focuses on single patentable molecules, even when the problem is multifactorial. Unpatentable solutions like lifestyle protocols, supplements, or peptides rarely get large trials because there's no billion-dollar payoff. This is why you'll find dozens of studies on the latest pharmaceutical drug, but very few large-scale studies on the impact of, say, addressing nutrient deficiencies or supporting your body's natural detoxification pathways. And let's be real about what this means for you. When you're dealing with conditions such as perimenopause or menopause, the standard approach is often hormone replacement therapy, which can be helpful. But rarely does anyone talk about supporting your adrenals, addressing insulin resistance, optimizing your gut health, or managing the stress that's making everything worse. It's not that these single solutions are always wrong, it's that they're incomplete. Your body is asking for a comprehensive approach, but the system is only set up to give you one piece of the puzzle at a time. Now we're getting to the part that really fires me up. How many of you have ever been told that your symptoms are psychosomatic, you're just aging, or my personal favorite, it's all in your head? If you're nodding right now, I want you to know you're not crazy, you're not imagining things, and you're not just getting older. And this is especially true for women over 40 or 50. When you're dealing with the complex hormonal shifts of perimenopause and menopause, your symptoms often don't fit into these neat diagnostic boxes. You might have fatigue, you might have brain fog, mood swings, weight gain, sleep issues, and joint pain all at the same time. But because these symptoms cross multiple body systems, you often get dismissed or told, it's just hormones. It's just stress. But here's what's really happening. You're experiencing the downstream effects of metabolic dysfunction, hormonal imbalances, nutrient deficiencies, toxic overload, or chronic inflammation. These are real. They're measurable and treatable conditions. The problem is that our system isn't set up to identify or address root causes. Here's what the research shows. Personal health responsibility is shaped by both individual behavior and system level factors. Outcomes improve when the system supports self-management through education, trust, and partnership, not blame. But instead of acknowledging the system's limitations, what happens? The responsibility gets shifted on you. You're told you need to exercise more, eat less, manage your stress better, be more compliant with your medications. And when that doesn't work, well, clearly it's all your fault for not trying hard enough. If you've ever felt like your doctors are all looking at different pieces of the puzzle, but no one's putting the whole picture together, you're not imagining it. Surveys reveal that the number one driver of patient dissatisfaction isn't noncompliance, it's feeling unheard, dismissed, or bounced around between providers with no one really advocating for their care. This is why I do what I do, because I've seen too many brilliant, intuitive women who know something is wrong with their bodies, but they get told they're imagining it or it's just part of getting older. And I'm going to say it again. Your body isn't broken. Your intuition about your own health is not wrong. The system just isn't designed to support the kind of comprehensive root cause approach that chronic conditions require. All right, beautiful people, I'm going to go ahead and wrap this up with some hope and a few action steps. Today, we talked about why so many of us, especially women over 40, are dealing with chronic illness and metabolic dysfunction. We feel unheard and let down by the healthcare system. We've explored how the system was built for acute emergencies, but struggles with chronic, interconnected conditions. We've discussed how economic incentives favor symptom management over root cause healing. And we've acknowledged that you've probably been gaslit, but the real problem is systemic, not personal. Here's what I want you to take away from today. You are not broken. The system is. And while we work on changing the system, you can start advocating for your health right now. Demand comprehensive testing, ask questions, seek providers who will listen to you and work with you as a partner. Invest in your own health education and trust your intuition about your body. And remember, when someone tells you your systems are just about getting older or it's all in your head, that's not medical evidence. That's a systemic limitation. You deserve better, and better is possible. And if you want to start taking control of your health journey today, check out my proven strategy to reset your metabolism at beginhealingtoday.com. I'll help you understand what your body is really asking for and how to give it what it needs to heal. And if you enjoyed today's episode, seal the deal to heal by leaving a review and sharing with a friend who needs to hear this message. Thank you for listening, and remember, your health is your birthright. And until next time, go out there and achieve more freedom in your health and your life. Take care. Thank you for listening to today's episode. If you enjoyed the show, seal the deal to heal by leaving a review, subscribing to the podcast, and sharing with a friend. Thanks again, and we'll continue the journey next week.